Hi everyone, I'm going to tell you a little bit more about Piriformis syndrome today. I wrote a little blog post on that you can learn more information about it. But essentially the Piriformis is an external hip rotator in this most simplest sense that it connects from your femur to your tailbone. And we'll leave it at that. Now it's closely related with the sciatic nerve, and therefore oftentimes it can be confused with typical sciatica that happens in people. So I'm going to show you 3 easy things you can do at home that will help to ease some of the burden and some of the pain that you get associated with Piriformis syndrome. The first one that I'm going to do that anyone can really do at home is if you're lying on your back, you can bring one knee up and then rotate it across your body. And where you're going to feel the pull is in the back side of your glute, and you can hold that and really feel that stretch until it eases up. The second exercise is utilizing a foam roller on the back of your glute. Now the best way you can do this is sitting on all fours, kind of like a crab position, knees bent. Slide the foam roller under your hip. You can simply roll it back and forth if you please, but one thing I like doing is bringing the same leg that you're trying to target up and externally rotating the hip by putting your right foot, so if you're targeting the right side, you put your right foot on your left knee, lean into it, and you kind of rotate, play around with it, and you're going to feel some of those pain spots in through the back of the hip. So you can use standard or a foam roller like this, more of a rumble roller, more of a standard foam roller that's nice and smooth. It will be a little bit easier if it is really tender. And if you really want to dig deeper, you can use a ball such as this, which is a rock ball, and you can simply roll on that spot so you can be more specific when you're targeting the Piriformis. The last stretch that I'd like to show you is the pigeon pose, which is taken from yoga. It's a great one you can use. You can really lean deep into it to stress the muscle quite a bit. And I'm going to show you from both directions just so you get an idea of how you want to position it. So from the front, you're basically going to walk your hip up, put it across, straighten your back leg out, and then simply lean back onto your hip. And I feel it's a great exercise or stretch to do consistently to open up the back of your hip, but it's a really good one if you want to open up the external rotation in your piriformis and some of the associated muscles around there. So from the side view, same thing, bring your leg up, straighten your other leg. If you want to put more strain on the back of your hip, you can sit up and really put your weight back onto your hip so you sink deeper into that stretch. Try these out, do them consistently over a period of time, and I'm sure if you do, and you do have Piriformis syndrome, it will probably mitigate a lot of the strain that you're feeling. Take care.